Hi, my name is Sally Cox and I am here today with my colleague Fiona Mokes to share with you the story of our Welsh health mapping tool, Health Maps Wales. I am going to cover the background of Health Maps Wales and then Fiona will describe how the product has recently been migrated over to Instant Atlas Online using Esri Maps. First, I wanted to explain the health geographies within Wales. NHS Wales delivers services through 7 local health boards and 3 NHS trusts. The current structure of health administration in Wales came into effect on the 1st of October 2009, when a total of 22 local health boards merged to form 7, each covering its own geographical area. Each health board is responsible for planning and delivering NHS services in their areas. In addition, there are 3 NHS trusts: the Welsh Ambulance Service, Valinda NHS Trust and Public Health Wales. These are responsible for public health, ambulance services, as well as cancer and blood services across the whole of Wales. In addition to the health boards and trusts, there are a number of supporting organisations. Health Education and Improvement Wales leads on providing education, training and development to the healthcare workforce. NHS Wales Shared Services Partnership provides customer-focused support functions and services, and Digital Health and Care Wales, previously the NHS Wales Informatics Service, is a new special health authority created to take forward the digital transformation needed for better health and care in Wales. Within Digital Health and Care Wales, the Information Services Directorate manage and maintain an all-Wales data repository on behalf of NHS Wales. As well as managing the data warehouse, the Directorate is responsible for processing and transforming the data into products to help NHS Wales deliver its services. Data sets include hospital admission data, outpatients, child health, the National Cancer System CANISC, A&E attendances, critical care and many more. Back in 2009, the Health Maps Wales project began. It was sponsored by Welsh Government and its development was guided by a steering group comprising of members from Welsh Government, Public Health Wales and other NHS Wales organisations, with the aim of making nationally collected population-based data more readily available. Its aim was to present simple visual and geographical analysis of complex health data across a number of Welsh Government programme areas, such as unscheduled care and chronic conditions, into one place to promote collaborative working and identification of health inequalities to support continuous improvement. Health Maps Wales was initially developed using the Geowise Instant Atlas product and Ordnance survey background mapping. Previous versions of the product can be seen here on this slide. Health Maps Wales currently contains hundreds of indicators spread over 20 themed areas, including circulatory system diseases, substance misuse, maternity and child health, external causes, and common procedures. The maps allow users to explore data by area, map trends in data over time, and compare areas against local or national figures. Bringing data together from different data sources provides a more complete picture of health, including the ability to look at the correlation between different factors, such as deprivation. The mapping tool provides valuable support to public health professionals, allowing them to quickly uncover patterns, trends, or anything irregular, stimulating more in-depth investigative work where appropriate. The occurrence of health conditions often varies by important determining factors such as age and gender, and so data has been standardised to enable robust comparisons between different geographical areas. Health boards often want to monitor the effectiveness of targeted work, with the ability to compare locally and nationally, spotlighting areas of good practice. Furthermore, information has been made available for small areas using census output areas, which nest within local authorities and health boards, allowing targeted planning and a better understanding of the situation locally across Wales. Additionally, as information is published publicly, researchers, patient groups and other interest groups outside of the NHS are able to also access the data. Datasets within Health Maps Wales are updated annually, and our main users include public health government, academia and the NHS. Latest figures show that we have on average about 20 users per day. In 2019, we worked on a collaborative project with Public Health Wales, the Finance Delivery Unit and the Wales Cardiac Network to develop a cardiovascular atlas of variation. This was produced on the request of the Welsh Government to inform a programme of value-based cardiovascular care for Wales. The atlas was produced using routinely collected data on activity, financial costings and outcomes, and the aim was to raise questions and identify variation in key aspects of cardiac care within Wales. Data was overlaid onto maps to explore the whole population in need and not just those who happened to make contact with a particular service. All of the maps for the atlas were published within Health Maps Wales and exported for use within the published document. Following this, in 2019, Geowise became part of Esri UK and moved to a cloud-based environment called Instant Atlas Online using ArcGIS maps. Support for the existing product was about to cease and we began talks with Geowise about migration to a new platform. Then the pandemic hit and developing products to support the COVID-19 response became the priority. We picked this back up with Esri UK in August 2020 and began the journey to move the existing service to Instant Atlas Online. I will now pass you over to Fiona to take you through the migration. Many thanks.
Hi, my name is Fiona Mokes and I work as an information analyst at Digital Health and Care Wales, mainly working on analysing and publishing public health data, including the Health Maps Wales. Migrating to the new Health Maps Wales website has been quite a challenge for us as it utilises 3 different software packages that we had no experience of using: ArcGIS, Instant Atlas Online and WordPress. Luckily, we did have some support from Esri to guide us through the process. In this presentation, I will give you an overview of the steps required and some of the obstacles we encountered to get the new website up and running. The initial step was to get the data into ArcGIS. This diagram was provided by Esri and helps to illustrate the basic steps needed to upload the data. The first step was to manipulate our existing SQL scripts to organise our data into flat CSV file format that is required by ArcGIS. The second step was to create feature layers in ArcGIS and utilise Python scripts to join the relevant geographies and CSV data files to the newly created feature layers. And the final step was to create a data catalogue and a metadata catalogue in which the newly created feature services are referenced and which can then be utilised by Instant Atlas Online. Because of the amount of data we published, this was easier said than done. To give an example, here is some data that we published for cancer mortality at health board level. As you can see in the previous format, all of the data held in our SQL tables is organised in columns. ArcGIS requires the data to be in flat CSV format. Each indicator requires an ID. Each ID requires a date key. So in this example, D0 is the latest year of 2019, DM1 is 2018 and so on. And if you require more than one value, so for example, in our data, we also publish numerators and confidence limits, then a separate ID is required for each value that you want to upload. New SQL scripts were required for all of our indicators in order to pivot the data to get it into the correct format. There is also a limit to the size of tables in ArcGIS Online, so this ends up restricting the number of data value columns in the CSV files to around 900. We published 10 years of data for each indicator across multiple geographies and for both single years and 3-year averages. Cancer mortality alone has 42 different indicators, so we had to split our data and ended up with more than 500 CSV files to load. Once the data had been extracted from SQL to the CSV files, the next stage was to get the data into ArcGIS. This involved creating feature layers containing the geographies required and then uploading the CSV files to the relevant feature layer. Last year we didn't have an ArcGIS Pro license, so Esri provided us some Python scripts to do this. With a large number of CSV files that we had to load, this was a slow process. When the feature layers have been created, ArcGIS produces a URL for each geography, which is then referenced in the final part of the process, which is the data catalogue. The data catalogue or master table references all of the geographies, themes, indicators and instances that will be used in the final Health Maps Wales website. Here is an example of part of the data catalogue for one of our indicators. This is for cancer mortality, 1 year time period, and for persons and all ages. We publish this indicator at 5 geography levels to the theme of cancer, the sub-theme cancer mortality, and with 10 years of data. We can see the geographies referenced at the top, then the theme and sub-theme, then the indicators, which in turn reference the theme and geographies, and then finally the instances, which reference the year, the geography, and the indicator ID. The instances also reference the URL of the ArcGIS feature layer to which they've been uploaded. In total, we have 17 geographies, 25 themes, 46 sub-themes, over 1,200 indicators, and over 38,000 instances, so our data catalogue is huge. Once all of the data is in ArcGIS and we've created and uploaded the data catalogue, we get to the final stage, which is publishing the data and creating dashboards using a combination of Instant Atlas Online and WordPress. Again, we had help from Esri to create a template similar to our old Health Maps Wales website. All of the indicators can be accessed via the Data Explorer or explored through the Themes menu, but we're also in the process of creating dashboards for each theme using the Instant Atlas Dashboard Builder. The Dashboard Builder gives you a selection of layouts and widgets which you can then configure, changing the size, shape, position and colours in the dashboard. The Data button allows you to link to your data catalogue and to choose which indicators to display. It also allows you to add confidence limits and comparison areas. Once the dashboards have been created, they can be shared using JavaScript. We embed the JavaScript into the new page on the WordPress site and then add the page to the menu, which in turn allows the dashboard to be viewed on the Health Maps Wales website. We're hoping for our next release we'll have more dashboards available to give a more interactive experience. The Health Maps Wales website is always evolving, with new indicators being added each year, and we are happy to have any suggestions if there are any indicators that you would like to see. I hope this has given you an idea of the process, and if you have any questions about the website, we'll be happy to answer any queries. Thank you.